Hello, my name is Rachel Saputo Abarca, manager with Blue Cross Blue Shield of Michigan. Welcome and thank you for being here. Our presentation today will cover key terms and your out-of-pocket costs, your 2025 medical plan updates, understanding how your medical plan cost share works, choices for convenient care, how to get the most value from your medical plan, your routine hearing care coverage through True Hearing, Medicare basics, and how Medicare works with your retirement system medical plan, and resources to help you succeed, including how to contact Blue Cross. Throughout the presentation, you'll see Medicare-specific terms and benefits shown in purple and non-Medicare specific terms and benefits shown in orange. Let's talk about the key terms that are associated with covered services and explain how cost share maximums are a financial safeguard for you. It is important to understand how your medical plan cost share works. Some services covered by your plan are paid in full by your retirement system, but most of the time you must pay for a portion of the cost of your claims. The amount you pay for covered services, referred to as your cost share, is explained in detail in your benefit guide, which is available to you online. These are the cost share terms you need to be familiar with. Deductible is the amount you pay each year before your retirement system begins to pay. Until you reach your annual deductible, you pay 100% of your covered medical expenses. The deductible for Medicare members and for non-Medicare members fully participating in the Living Well program is $800 and will not change in 2025. The deductible for non-Medicare members who do not fully participate in the Living Well program is up to $1,000 and will not change in 2025. You can learn more about the Living Well program in the Maximizing the Value of Your Plan portion of this presentation. Coinsurance is the percentage you pay for covered services after you have met your deductible. Coinsurance being applied after the deductible is a change that I will go over in more detail in the 2025 Plan Updates portion of this presentation. For most services you receive from PPO network providers, you pay 10% of the approved amount for the service. Your retirement system covers the remaining 90% of the cost. You can learn more about in-network PPO providers and how using them can save you money in the Choices for Care portion of this presentation. A copayment, or copay, is a flat dollar amount that you pay for covered healthcare services. Your retirement system plan has a copay on 3 medical care services: emergency room visits, urgent care visits, and routine hearing care. The coinsurance maximum is the maximum amount of coinsurance you'll pay in a calendar year for in-network services. How it works is that we keep track of the 10% coinsurance you pay throughout the year. Once you reach the coinsurance maximum, you stop paying the 10% coinsurance for the rest of the year. The good news is, just like last year, your coinsurance maximum in 2025 is $900. If you're using non-network providers that are not in the PPO network, you're generally paying a 30% coinsurance. In this case, once you meet the $900 coinsurance maximum, your 30% coinsurance is reduced to 20% for the remainder of the calendar year. The out-of-pocket maximum applies to Medicare members only. It is the most Medicare members pay for claims cost in a calendar year, with the exception of copays for routine hearing exams and aids, which do not apply to the out-of-pocket maximum. The out-of-pocket maximum in 2025 for Medicare members is $1,700, same as it was in 2024. Let's take a look at the changes to your medical plan for 2025. If you are a Medicare member or will be eligible for Medicare in 2025, beginning January 1st, 2025, your emergency room visit copay will be increased from $135 to $140 per visit. Remember, your emergency room copay is waived if you are admitted to the hospital within 72 hours. If your condition is not a life-threatening matter, please go to your nearest urgent care office. Your copay remains $65 for urgent care services. For non-Medicare members, starting January 1st, 2025, your emergency room visit copay will be increased from $135 per visit to $140 per visit. Copays for emergency room visits begin after you have paid your annual deductible and reached your coinsurance maximum of $900 for 2025, which remains the same from 2024. Just like members on Medicare, the emergency room copay is waived if you are admitted to the hospital within 72 hours. If your condition is not a life-threatening matter, please go to your nearest urgent care office. Your urgent care copay remains $65 for 2025, and for non-Medicare members, the annual deductible and coinsurance maximum must be met before the copay applies. Currently, your medical plan applies coinsurance before deductible. Beginning January 1st, 2025, your retirement system medical plan will apply the deductible before coinsurance for Medicare and non-Medicare members. Remember, the deductible is the amount of money you pay for care before the retirement system plan starts paying. Your plan covers some services such as preventive care before you reach your deductible, but for most services, you'll pay the full cost until you reach the deductible. After you reach your deductible, you'll still have to pay coinsurance and any copays. In the key terms and your out-of-pocket costs portion of this presentation, we covered that your annual deductible and coinsurance maximum amounts will remain the same in 2025. It is important to know that the order of how your out-of-pocket costs are applied to your services is changing. The new way we calculate your share of costs may result in you paying less over the course of the year. We know that health insurance terms and how things work can be confusing. Let's take a closer look at how your cost share works by reviewing some payment examples. We are going to walk through how the plan's cost share works using an example. This is Darren. Darren receives 3 medical services over the course of the year. For the purpose of this example, let's assume the following. Darren has an $800 deductible. This means he is enrolled in Medicare or he's a non-Medicare member fully participating in the Living Well program. However, if he was a non-Medicare member who did not fully participate in the Living Well program, he would have a higher deductible. Because he uses in-network providers, his coinsurance will be 10%. We'll also assume that Blue Cross has approved $500 to be paid for each service. Using this information, I will show you how Darren's out-of-pocket costs are calculated and tracked throughout the year. In the first example, Darren has paid nothing towards his deductible prior to receiving medical services. First, we calculate how much he owes towards his deductible. Since the deductible is $800 and the approved amount of the service is $500, the amount owed for the deductible is $500. All $500 is applied toward the annual deductible, and Darren owes nothing in coinsurance. The retirement system pays nothing in this example since Darren must meet the $800 deductible before the plan begins to pay any costs. As you can see at the bottom of the slide, Darren has now paid $500 towards his $800 deductible, and nothing gets applied to the coinsurance maximum. In this next example, Darren had another covered service with an in-network PPO provider, and Blue Cross approved $500. First, we calculate how much Darren owes towards his deductible. In the previous example, Darren paid $500 toward the annual deductible. This leaves a $300 remaining balance, so Darren needs to pay $300 to satisfy the $800 deductible. You can see this under the amount owed toward the deductible column. Next, we calculate what Darren owes in coinsurance. Coinsurance is a percentage of the approved amount that you're responsible for paying after your deductible has been met. Because Darren used an in-network provider, his coinsurance is 10% of the approved amount. Remember, the deductible is now applied before coinsurance. The 10% coinsurance is going to be applied to the approved amount after it is reduced by any amount paid toward the deductible. So you take the approved amount of $500 and subtract the amount paid toward the deductible, which is $300. The remaining approved balance becomes $200. 10% of $200 is $20. Therefore, Darren owes $20 in coinsurance. Now let's calculate Darren's total share of costs for this service. Darren would first pay $300 toward the deductible, plus the $20 in coinsurance. Therefore, his total out-of-pocket expense for this service would be $320. The retirement system would pay the remaining balance of $180. Now that the deductible is met, you can see that the retirement system is beginning to pick up its share of the costs. At the bottom of the slide, Darren has met his $800 deductible for the year, $500 from the previous service, and $300 paid from this service. Darren owes nothing more towards his deductible. The $20 paid in coinsurance is applied to the coinsurance maximum. Let's take a look at the last example. Darren saw an in-network PPO provider, and Blue Cross again approved $500 for covered medical services. Let's start by determining Darren's deductible. As shown in the previous example, Darren has already met his $800 deductible. Therefore, the deductible amount owed is $0. Next, we calculate what Darren owes in coinsurance. Since the service was rendered by an in-network provider, his coinsurance is 10% of the approved amount. Coinsurance is calculated after the deductible, so the 10% is going to be applied to the approved amount after it is reduced by any amount paid toward the deductible. Since nothing was paid toward the deductible on this service, the 10% coinsurance is applied to the $500 approved amount. 10% of $500 is $50. Darren owes $50 in coinsurance. Darren's total out-of-pocket expense for this service would be $50. The retirement system would pay the remaining balance of $450. As you can see at the bottom of the slide, Darren has met his deductible for the year. He's also paid a total of $70 towards his coinsurance maximum, which includes the $50 coinsurance payment from this service and the previous coinsurance payment of $20. Now that the deductible has been met, Darren will continue to pay coinsurance for future services until he has met the $900 coinsurance maximum for the plan year. With a Blue Cross online member account, we've made checking the status of your out-of-pocket costs easy. You can learn more about the benefits of a Blue Cross online member account in the Member Resources portion of this presentation. As a Blue Cross Blue Shield PPO member, you have many options for obtaining the right care for you and your family. With the 24/7 nurse line, you can talk to a registered nurse at no additional cost, day or night, and get medical advice. The 24-hour nurse line can help you decide if you should head to the doctor or schedule an online visit, pick up over-the-counter medicine, or simply get some rest. Call 1-855-624-5214 and listen to the prompts to speak to a nurse. TTY users should call 711. Having a good relationship with your doctor is important. A primary care provider, or a PCP, is a doctor of internal medicine, family practice, or general practice. Typically, this is the physician you see the most. Your PCP gets to know you, your medical history, and lifestyle so that they will be in the best position to perform your regular checkups, refer you to specialists, or coordinate any necessary hospital care. They monitor the big picture of your health. And if they are an in-network primary care provider, they may also save you money. In-network providers have agreed to accept Blue Cross's approved amount, which means you pay less for your care. If you're using providers that are not in the PPO network, you're generally paying higher costs, 20% or 30% coinsurance. When you choose a PCP, you'll want to focus on providers with a patient-centered medical home PCMH distinction. A patient-centered medical home doctor leads a team of healthcare professionals who will work together to provide you care. Your PCMH team provides you with a personalized care plan to help you reach your goals. There are many benefits you can expect to receive when working with a PCMH doctor, including flexible and/or extended office hours, help with coordinating visits to specialists, training and education to help you manage chronic conditions, and help accessing community resources. If you don't already have a primary care provider, consider choosing one today. This is an essential step you should complete in order to get the most value from your plan. To find a provider in the PPO network, including a PCMH doctor or a participating durable medical equipment DME provider, visit bcbsm.com/findcare. If you don't have access to a computer, call 1-800-810-2583 and we'll help you find a provider. TTY users should call 711. Whether you see your own primary care provider or need after-hours care, online or in person, you have choices for care that are always there. Your medical plan offers many valuable programs and resources. Now let's talk about how you can get the most value from your medical plan and help keep your costs down. You've likely heard about the importance of getting an annual physical. Seeing your primary care provider once a year can help identify potentially harmful health issues in early stages and even prevent them from happening at all. This is also a good opportunity to update your primary care provider on your well-being and ask personal health questions that matter to you. Whether you are Medicare eligible or not, your routine physical exam and standard routine labs are covered once per calendar year at no cost to you in the PPO network. However, if a sign or symptom of illness is discovered during an exam, all further testing and exams are considered diagnostic procedures, and diagnostic out-of-pocket costs will apply. Something to keep in mind when you schedule your physical is that your doctor may want you to get additional tests that are not covered, like a screening EKG. Therefore, it's important to ask your doctor in advance what tests are performed with your physical exam. Call Blue Cross customer service to verify if the recommended tests are covered. Living Well is a program for retirees and covered family members that provides tools to help you lead a healthier lifestyle while rewarding you for making healthy choices. If you're enrolled in Medicare, you are automatically enrolled in the Retirement System's Living Well program, which gives you the lowest deductible, $800. Non-Medicare members can earn a deductible credit of $200 when they complete all the steps to enroll in the program. To enroll in the 2025 Living Well program, you must complete steps 1, 2, and 3 by December 31st, 2024. The first step is selecting a primary care provider. Whether you're enrolled in Medicare or not, one of the best things you can do for your health is to select a primary care provider. Keep in mind that a primary care provider is not a specialist. When you select your primary care provider, we strongly suggest you select a doctor that is part of a patient-centered medical home, PCMH. You can learn more about benefits of using a PCMH doctor in the Choices for Care portion of this presentation. The second step of the program is to complete the Living Well Health Questionnaire. It has a list of questions that can help you and your healthcare provider build a plan for you to live well. The Living Well Questionnaire was mailed to non-Medicare members in September. Step 3 is seeing your primary care provider to get a routine physical exam. The routine physical exam is covered in full in the PPO network. A physical exam you receive any time during 2024 will count toward this step. Non-Medicare members will earn a deductible credit of $150 by completing steps 1 through 3. You can earn an additional $50 credit by choosing a PCMH doctor in step 1, resulting in a $200 deductible credit. This means you will have an annual deductible of $800 for 2025. This slide is specifically for non-Medicare members. Medicare members, you already have the lowest deductible, so the Living Well program doesn't affect your cost share. However, we strongly encourage you to get a routine physical exam to help maintain or improve your overall health. Our Blue Cross Coordinated Care Core program is a comprehensive program for Medicare members led by a nurse care manager. This team works to uncover and manage the needs of our members and coordinates with the other resources on the team to provide personalized support. If you are managing a chronic condition or in need of support navigating complex healthcare needs, our care team is here to assist. To connect with a nurse manager, call Blue Cross Engagement Center at 1-800-775-2583. TTY users should call 711. Non-Medicare members have access to the Blue Cross Coordinated Care Advocate Program. Advocate is a program that will help make healthcare less complicated. With the Advocate program, your healthcare journey begins by connecting you with a care advocate. A care advocate is a registered nurse who gets to know you and your care needs. You can turn to them with questions like, I left the ER with a recommendation to see a specialist. How do I find one? Or what prep work can I expect to do before my surgery? Care advocates can help you resolve issues related to your health and coordinate care with your healthcare providers, make health decisions, help you gain a better understanding of your condition, medications, and treatment options. Find an in-network doctor or provider and schedule appointments. The Advocate program will connect you with resources and services in your local community. To connect with a care advocate, call Blue Cross Customer Service at 1-800-422-9146, Monday through Friday, 8:30 a.m. to 5 p.m. Eastern Time. TTY users should call 711. Your retirement system health plan covers many vaccines to keep you healthy. As a Medicare health plan, the plan must cover all services covered by Original Medicare and must follow Original Medicare's coverage rules. Therefore, some of the vaccines are covered by your medical plan administered by Blue Cross. Other vaccines are covered by your prescription drug plan administered by Optum Rx. The following vaccines are covered under the medical plan administered by Blue Cross: COVID-19 vaccine, hepatitis B vaccine, influenza flu vaccine, and pneumonia pneumococcal vaccine. Take time to review the comprehensive vaccine coverage guide located online at bcbsm.com/MPSERS. The guide outlines your medical and prescription drug plan vaccine coverage. Non-Medicare members have vaccines covered by Blue Cross and your prescription drug plan administered by Optum Rx. Because vaccines are covered by both Blue Cross and Optum Rx, you can present both membership cards before getting your vaccine. Take time to review the comprehensive vaccine coverage guide located online at bcbsm.com/MPSERS. The guide outlines your medical and prescription drug plan vaccine coverage. You have a state-of-the-art routine hearing benefit program through TruHearing. Your routine hearing benefit remains the same for 2025. You have a comprehensive routine hearing care benefit, which covers a routine hearing exam and a variety of hearing aid options once every 36 months. You have a $45 copay for the initial hearing exam. Hearing aids are categorized as advanced or premium based on the level of technology selected, and you pay a copay per hearing aid. The TruHearing benefit also includes 60-day trial period, 80 batteries per aid, and 1 year of follow-up visits, and a 3-year full manufacturer warranty on all devices. Remember, routine hearing exams and hearing aids are only covered through this program. You must see a TruHearing participating provider, and TruHearing needs to set up your initial appointment on your behalf. Please contact TruHearing at 1-855 205 6305 and follow the instructions you're given. TTY users should call 711. Navigating healthcare can be confusing, especially for members who are becoming Medicare eligible due to disability or soon to be celebrating their 65th birthday. As a retirement system member, when you become Medicare eligible, you must ensure that you have both Parts A and B. Parts A and B together create what is called Original Medicare coverage. If you do not have both Parts A and B, you will not be eligible for your retirement system medical plan coverage. Typically, there is a premium paid for Part B coverage only, and that premium is based on income. Medicare Part A is hospital insurance and covers hospital care, skilled nursing facility services, hospice care, and home health care services. Medicare Part B is medical insurance, and covered services include doctor visits, some preventive services, lab tests, and durable medical equipment. Medicare Advantage, also known as Part C, offers additional medical benefits not covered by Original Medicare. Your retirement system offers a Medicare Advantage plan for members eligible for Medicare. This plan combines the benefits of Original Medicare Part A and Part B with the benefits provided by the retirement system to form one medical plan. You must have Medicare Parts A and B to be eligible for your retirement system medical plan coverage. Your Medicare Advantage plan covers preventive services, including 25 exams and screenings covered at 100%, coverage while traveling within and outside of the U.S., and routine hearing care provided exclusively by TruHearing. Remember, once you receive your Medicare ID card, you must contact the ORS as soon as possible to ensure that you are signed up for the Medicare Advantage plan without a lapse in coverage. You should receive your Blue Cross member ID card prior to your effective date. Please put your Medicare ID card in a safe place. Only present it at your provider's request. Your Blue Cross ID card is the only card you will use when seeking medical services with a provider. Your provider needs to bill Blue Cross Blue Shield of Michigan for payment consideration. You want your provider to bill Blue Cross directly, not Medicare. Your convenience is important to us. We have created a number of different resources to ensure that your benefits and programs are available to you wherever you are. We've talked at great length today about your retiree medical plan benefits, programs, and cost. Whether you'd like to get tips on trying to control your diabetes or you want to find healthy recipes, there is valuable content online at bcbsm.com/MPSERS. Our site makes it easy for you to manage your medical plan online. Here are just a few things you can do on the website. View your 2025 annual documents, which include annual notice of changes, Medicare only, evidence of coverage for Medicare only, summary of benefits, resource guide, vaccine guide, and your member benefit guide. Attend webinars or watch presentations that can help you better understand your plan and explore health topics. Find a variety of resources to help improve your overall health. Take control of your medical plan with our convenient online member portal. Once registered, you can easily access all your essential plan information in one secure place. You'll have the tools, information, and support to help you understand your plan, how it works, and what is covered. Once you are logged into your online account, select My Coverage to view covered benefits and annual benefit documents, such as the Summary of Benefits and Resource Guide. From here, you can also track your out-of-pocket expenses for the year. Select My Claims to know what services providers charged you and costs covered. You'll want to use this information when reviewing your EOB. You can also sign up to receive your EOBs electronically. Use the Find a Doctor tool to search for PPO network providers, PCMH doctors, view quality designations, and get directions. Non-Medicare members can compare prices by provider, location, or facility using our cost calculator tool. Select ID card to view, print, or order a replacement member ID card. If you're at the doctor's office without your Blue Cross member ID card, just log in to the mobile app, pull it up, and present it to the office staff. Select rewards and discounts to view a variety of health products and services exclusive to Blue Cross members. If you don't have an online member account, it only takes a few minutes to register. Visit bcbsm.com/register and select Register Today. Once you have created a logon ID and password for your Blue Cross online member account, you'll use the same information to access the Blue Cross Blue Shield of Michigan mobile app. You'll see the same information when you log in to your member account on the website. You also have access to a virtual member ID card, health and well-being resources, Blue 365 member discounts, and a cost comparison tool, currently available for non-Medicare members only. When using the Blue Cross mobile app, your medical benefit information stays with you wherever you go. If you need help with downloading the mobile app or using the mobile app, call Blue Cross Web Support Team at 1-888-417-3479, Monday through Friday, 8 a.m. to 8 p.m. Eastern Time. TTY users should call 711. Medicare and non-Medicare eligible members enjoy access to the Best of Health newsletter. This publication is created especially for our Michigan Public School retirees and is published quarterly. You can find the Best of Health library online at bcbsm.com/mpsers/for members. It is also available by email. Your Best of Health newsletter provides information from the Michigan Office of Retirement Services and each of your health plan vendors. Topics include health plan coverage, nutrition, fitness, health and well-being resources. Stay informed by exploring your Best of Health archives online today. Throughout this presentation, we've covered a lot of information about your 2025 medical plan benefits. To explore these key points in more detail, we've included articles in the Best of Health Fall 2024 newsletter located in the Learning Center and a printable version of this presentation in the auditorium. If you have questions about your retirement system medical plan, call 1-800-422-9146 Monday through Friday, 8:30 a.m. to 5 p.m. TTY users should call 711. This number is also on the back of your Blue Cross member ID card. You can also find plan information online at bcbsm.com/mpsers. Remember, if you have pension payment questions or need your address changed, you'll need to log into your ORS My Account to make the change or contact the ORS by phone at 1-800-381-5111. TTY users should call 711. Thank you for your time today.